The Cardus team was in Ottawa today to deliver a new report on end-of-life care for Canadians entitled Death is Natural. This report comes as part of a new project from Cardus entitled Cardus Health.
Cardus Health is about the complete range of the delivery of life care. It's not even about health care. It's about the complete system of social supports, which include health, that are necessary for us to be able to die the way that most of us would like to die. When you ask Canadians how would you like to die, 75% say, I would like to die of natural causes surrounded by my natural caregivers in my natural environment. 70% end up dying in hospitals. There's a huge disconnect between what we aspire to and what actually happens. And we're about talking about what are some of the ways that that disconnect, that bridge can be narrowed.
Those of us who care for patients with progressive illnesses every day have witnessed how, because it seems to be so far away from the normal day routine, that as a society we don't know what it's about anymore, what the dying process is about anymore. And so I think there are a lot of myths and misunderstandings. And so I particularly like the focus of the report in terms of normalizing the dying process.
I was quite surprised. Many Canadians have a significant level of concern about their end-of-life experience and respect for that. And that was really quite striking, considering how important that is to everyone. The fact that there's a very high level of anxiety surprised me. And the other thing that surprised me is that people are not very happy. I think only about 1 out of every 7 Canadians, when we ask them about the role of culture, the role of faith, the role of community in end-of-life experience, only about 1 out of every 7 were actually satisfied. And I think what that means is that Canadians are ready for a dialogue. They're ready to engage on this in a meaningful way. And I think that's why this particular study is quite important.
I think the other very important component of this report is the concept of continuum of care. And again, having worked in this field for many years, it is clear that we need different services at different parts of the illness journey. And there are situations where we need to have palliative care units. There are many situations where we need more home care support. There are some situations where we need hospice. So I think it's important that we recognize this continuum and that we need to have resources and services in the different parts of this continuum. And so I think as a country we can do much better right across all the provinces, I would argue, in terms of more people staying at home for longer until the end, and even for having some more people die at home. We also need to recognize that it's not always possible and it's not always the choice. And so it's important to have, as the report calls out, this continuum of care where we have the different services at different points.
I look at my own personal experience. My grandparents passed away at home. The wake was at home. The body was at home. It was a real family experience, kind of centered in faith and family. Fast forward 50 years, and I don't want to say it's become commercialized, but it's become impersonalized. But there has been a recognition that there is a vacuum there. What the research shows is that perhaps we should be looking to traditional roles in the past, right? Roles within families, within cultural communities, and within faith groups.
Canada's going to have double the deaths per year in 30 years that we have today as the baby boomers move through the system. We have a huge challenge facing us, and this report is beginning that conversation.
For more information on Cardus Health, visit us at cardus.ca/health.